G'day, it's Nigel here again. Welcome to the three-part series, and today's part two. Just a recap of yesterday. Yesterday we talked about tight hip flexors and leg length shortening, how one side being short can affect the pelvis and rotate the spine and cause problems in that way. So hopefully you've taken a bit of action and you've got yourself a heel raise and you've started and decided if you've got excess tightening in your hip flexors, you've started to stretch them out. We also talked about how the abdominals can become quite weak, especially when you have tight hip flexors. And I see so many times I go to a gym or a football field and see people training and doing sit-ups just woefully wrong, you know, like that. Really, I feel like walking up to them and handing them my card and say, I'll see you next week, you know, because if you do them incorrectly, you really put a lot of strain through your back. Not only that, you can increase the tightness in your hip flexors. So what I'll show you now is what I believe is the perfect way of doing a sit-up. I just want to demonstrate to you a couple of things, or the wrong way to do it really, and just hopefully you're not doing it this way. And next time you see people do sit-ups, you can pull them up and say, hey, here's the right way of doing it. So anyway, I'll just show you. So most people, when they do sit-ups, they hurl themselves up, and when you hurl yourself up and come up really suddenly, often you're using your hip flexors to actually do the movement. You're not doing anything with your abdominals. Your abdominals kick in later, but your hip flexors do the main work. So an example of that would be something like that. Like the hands on the hip, and you can see people just almost throw themselves up when they're doing the sit-up. Another thing I see people do, especially on the football field or on an oval, you'll see trainers getting players to lie on their backs and hold their legs straight like that for minutes on end, and that's supposed to make your abdominals tight. Well, what it does is it weakens the low back muscles are only so strong, and after a few seconds they just bugger out and they can't hold that position anymore. So there's a lot of strain goes through the joints in the back. So that all being said, here's how I believe you should do a sit-up. The focus shouldn't be so much in lifting your head up, it should be more bringing your ribs towards your hips. So if you can feel where your ribs are, as you come up, all I'm focusing on is getting my ribs down towards my hips. Okay, and that's as far as you need to come up. Basically just clearing your head and your shoulder off the floor. If you've got a bit of a sore neck, I recommend having a pillow. If you haven't got a sore neck, you're fine to go from there, but just keep your chin tucked in. Alright, so that's about it there. Now try and combine breathing with it as well. So as you come up, breathe out. So you kind of like, and once again, your focus is on lifting your ribs towards your hip. And to do diagonals to bring in your oblique muscles, what you can do is just come up and then just aim your elbow towards your left opposite knee. And there's your obliques done as well. Okay, so the other exercise that I think is probably, before I do that, here's a little tip. If you're lying in bed, a comfortable position is on your back with a couple of pillows under your knees. I've always found that when you've got a sore back, and I speak from experience, if you lie on your back and have a couple of pillows under your knees, it's the most comfortable position. It just relaxes your hips and just puts your back nice and flat into the bed. To get out of bed, what I see most people do is get out of bed like that. Now what that does is it immediately activates your hip flexors and sets you on a bad course for the day. So instead of doing that, roll to your side like that, and then legs over the edge and sit yourself up like that. Okay, now the second abdominal exercise I teach is called a plank, and we teach this in Pilates, and it's probably one of the easiest ones to teach. So all you do for this one is get into a plank position, hold the position for maybe 20, 30, seconds or up to a minute. You'll feel, probably to start with, you'll feel shaky, but just work through that a little bit, and never stay there as long enough to get pain. So if you get pain in your back, just stop and have a rest and then do it again. Alright, so I'll just show you how to do that. So on your elbows, up on your toes, and try and stay as straight as you can. Keep your head in a neutral position instead of having your head up like that. So just keep it neutral. And as you're staying there, you can just draw your belly button in, and that just activates it a little bit more. And to come down, just knees down first and relax. And then get yourself up. So that's it. They're the two ways I would suggest you start off doing abdominal exercises. During the following emails, you know, if you're on my email list, so I'll be sending lots and lots of videos of in the future, and just showing you different Pilates exercises too that you can add, and just pick out which ones that you are suited to. So that's the end of today's video, and I hope you got something out of that and you start to do some abdominal exercises the right way. So tomorrow we're going to talk about how to set up a desk and chair and an office space correctly. So that's a big factor in getting back pain during the day, especially if you're working in an office situation. So until then, look after your back. It's the only one you've got.